Hi, thank you very much for visiting our YouTube Lube channel and our website. With this coronavirus thing going on, I'm not with the CDC. I don't have much in the way of medical background, so I won't go into how serious it might be, the treatment, or how important it is to comply with the quarantine orders. Uh, that I do have links to on my website, but you're hearing it on the news, the newspaper, the CDC, uh, and all the other hopefully reliable sources. What I will talk about, and I do feel I have qualifications to talk about, is how will insurance pay for testing of the coronavirus? So the governor and the insurance commissioner came out and said that there'll be no co-pays, deductibles, no out of pocket. They're going to cover it under the preventative benefits for testing. Now, there does seem to be a problem in that they're not testing as many people as they should, but that's beyond my pay grade. So anyways, on this page, and for those of you watching on YouTube, I'll have the links in the comments. But on our coronavirus page, you'll notice that I'm just playing with the different size here. But anyways, I mean the size of my picture. Anyways, and see there, I just touched my face, but I washed my hands before I started this. So you'll see that we have like a main article here, and then we have additional resources and additional insurance you may want to get. But we went to a government source and we cite everything. For the symptoms of regular flu infections or the other coronaviruses, coronavirus 19 includes fever, cough, shortness of breath. And we got all this. We try and cite everything on our site to an official source. It's not my opinion. It's not my BS. I try to have everything to an official source. So here it is, medlineplus.gov. And you can take a read and get more detail. If you want to get instant quotes, because I'll get into it in a second, but you can get instant individual quotes. And if you don't have insurance, you can buy it now. So if you click here on our yellow instant quote button, it'll take it to our quote engine. You just put in your zip code, your age, and if you want subsidies, your income. And then you'll get quotes from all the companies. So back to our coronavirus page, we've cut and pasted all of the insurance company bulletins as to how they're looking at it, their FAQs and so forth. So you got Aetna, Cigna, Blue Shield, Blue Cross, Covered California. And Covered California just opened up enrollment. So if you haven't bought insurance, you can enroll now in Covered California. One problem may be is the effective date, and I really haven't checked that out yet, whether it's going to be, today's March 21st, so if you get it today, will it be effective April 1st or May 1st? We'll have to check. But their press release is, you can get that right there and it'll tell you. And there's no extra charge to use an agent for this. And one advantage with me, you send me an email, it's all taken care of. You won't have to be on hold for hours. And then you can get instant quotes. We've got Health Nets, Medicare's, and now telehealth is becoming a much bigger deal than it had been in the past. And here's a video from Oscar, who's been big in telehealth, on how that works. And it seems now that all the companies have it. United Healthcare, Word and Brown, uh, how workers' comp is dealing with it. If you've got anxiety, different ways to, deal with it. Uh, travel coverage with coronavirus, I've got information there. Here's our links to official information. And then you'll see it on Facebook. Wow, it's gone up 304,000 cases worldwide of coronavirus. And I'm not sure who does this, but it's a pretty authoritative looking website. 12,000 people. Now, the other thing to compare it to is how many people die a day of obesity, car accidents, cancer, the regular flu. Oh, but here, see, you've got almost 100,000 people that have recovered from this. So how serious this thing, really is, it's beyond my pay grade. Yeah, I don't want to scare anybody, but it kind of reminds me of a movie I saw years ago. And then if you have any questions, you can just post it right down here. So let's go over the other visual aids that I brought up. You can get a quote here at Steve Shore Insurance. Here's Covered California's website on it, but go through me. That's the only way I make a living. Covered California doesn't send me a check every month just for having a nice website. This is our special enrollment page, and we put a note there about it. And then at the bottom of every web page on our site, we do have where you can set a meeting. So first get your quote so that we know what we're talking about, and then we can set a meeting to get the application done. Now, if you need Medi-Cal, that enrollment is all the time. And I didn't think of it before, but let me get you the link for our Medi-Cal website. And anyways, here's our Medi-Cal website. And then you can just go in here to enroll Los Angeles. And so we've got the direct enrollment links for LA, and then also Alameda, Orange County, San Diego. And if you click this one, it'll be all California counties. If you're out of state, you're just going to have to Google Medicaid enrollment. And I believe nationwide, they're all, all the time that you can enroll. And also with Medi-Cal, they'll go back, at least Medi-Cal will go back 3 months. So if you were to get tested tomorrow, they put you in the hospital, you run up thousands of dollars a day. If you're poor, under 138% of income, you can get Medi-Cal and they'll go back 3 months. So why people are asking for Medicare for all, I think it's kind of a waste because we already have 1/3 of Californians on Medi-Cal. So thank you very much for watching. And if you have any questions, just email us and we'll be happy to help you. Thank you very much.